Hello everyone. As we all know, silicone oil is an important adjunct in vitreoretinal surgeries as it provides a good internal tamponade provided it's adequately filled. There is always chances of overfilling and underfilling the silicone oil and many complications are associated with it. Let's discuss about silicone oil related complications one by one. Silicone oil underfill is a common mistake which provides inadequate internal tamponade and doesn't serve the purpose in retinal detachment, especially if there are inferior breaks. It can cause recurrent retinal detachments due to inadequate support. So silicone oil adequate filling is important in such cases. Silicone oil overfill can cause silicone oil induced glaucomas. Silicone oil can cause mechanical obstruction when the silicone oil is completely filling the anterior chamber. This slit line photograph, we can see there is silicone oil inside the anterior chamber which is causing pupillary block, that is closed angle glaucoma. Silicone oil causes secondary glaucoma which increased intraocular pressure. This picture we can see emulsified silicone oil in anterior chamber. This picture we can see a gonio photograph of emulsified silicone oil blocking the angle, that is causing mechanical impediment of aqueous outflow, which in turn is increasing the intraocular pressure. Coming to the technique of silicone oil injection. After finishing the vitreoretinal surgery, we are providing silicone oil injection by 3 pars plana ports. One is connected to the inferior infusion cannula, one is connected to the vent, one is connected to the silicone oil injector. After completing the fluid air exchange, silicone oil air exchange is done. First, vent is removed once the silicone oil is almost filled along with the port. After the globe is formed, once the silicone oil is completely filled, the silicone oil starts going inside the infusion cannula. After completely filling with the silicone oil, we are going to be removing the second port and we will wait for the silicone oil to trickle back into the globe. After waiting for some time, once the silicone oil is seen going back to the globe, we'll try to push as much as possible to go into the globe, and once you ensure there is adequate silicone oil fill, we'll be removing the last port along with the infusion cannula, thereby ensuring the adequate silicone oil fill. This technique of silicone oil injection will be helpful for all the beginners and new vitreoretina fellows for adequate silicone oil injection. Okay, thank you.